Hello, I'm Yusuf from Cairo, Egypt. My first question is about global health infrastructure. During previous outbreaks, there have been promises of reform in health infrastructure for developing and developed countries alike. However, as the coronavirus demonstrates, there are still major flaws in health infrastructure in many countries around the world, even in developed countries like the United States. And vulnerabilities in the healthcare system of one country can affect the safety of the entire world. My question is, do you think in the wake of the virus there will be actual reform in global health infrastructure? And if so, how do you think we should approach it during the crisis and afterwards?
Very good, Yusuf. So that's a good question, and I fully understand your point of view, and it's a very valid one. So I don't see a short term solution. I think there's two things to consider. One is, on one hand, the sharing of information is much more democratic, is in a way, so you just need a computer and internet or even a smartphone to access the information. And uh, most scientific papers that are open. That's one thing that's important. Information, at least, it's available for most countries. I think one research that one type of research, not research, one type of research that again is still is not given that much importance is prevention. Again, basic prevention. I think that's as much as we learn the mechanism, as much as we can prevent in terms of even simple things as diet, sleep, and etc. So that can help as well. That can have a global effect if it is adopted. But at the end of the day, each country will have its own agenda, a health agenda, and infrastructure, and even international organizations. They have a limited way of influencing. So the way I see it is sharing information. I think that's the only way to have an impact. And of course, at the end of the day, using the data that's being generated by research. So I think that's the only way to try to influence at a local level. But I don't see a global effort. That's not my area in terms of this big broad policy, but I just don't see it having an impact in health infrastructure.
Hello, this is Alex Vilchis from Mexico. Right now, in our country, there's a lot of people that is not taking the right measures to protect against the COVID-19, but it's not only because they don't want to take the right path. It's also because they don't get their access to information to know what they should do in order to prevent the infection. So my question would be, what would you suggest for the youth people to do to make all of these people change their mind and start learning about the protection that they need to have against this virus, since most of them don't have access to internet or any other social media where they can see this information? Thank you.
Yeah, that's a very good question. So, and it's not a simple there's no simple solution here. So we started this discussion with myself discussing the benefits and how much advances the internet brought to medicine, to evidence-based medicine, but that also brought some dark aspects or some negative aspects, and such as exactly misinformation, not only lack of information. There's two different things. One is lack of information, and the other one is misinformation. Again, that's a difficult thing as well to say. I do agree that there has a big impact. This infection, it is something new. So when you have something new, when you have lack of information, it creates a gap that is easy to be fed by misleading information. I think organizations such as this one, and trying to as much as possible to provide that, to again teach as well. So the teach or share the sort of how to check for the information as well. So in terms, so that helps. But even though I think it's just difficult, and maybe there's an adjustment as well. So we've been seeing this explosion of misinformation, fake news, etc., in the past few years, but maybe there'll be a correction. So let us hope that that's the case as well. So these big media providers and social media as well providers, so hopefully they'll start thinking as well in novel ways to address this problem. And that's one thing that also you need to think as well. Anytime there's a problem, you also need some time to create a solution. Same thing with COVID-19, as I said. So it does take a while, unfortunately. So there will be a little bit of negative consequences before there are public policies to address that. But the awareness you are having, that's the first step.